Welcome to Sex with Rebecca, a show geared towards relationships and sexuality that'll help you enjoy your relationships more than you ever thought possible. So send us your difficult questions and we'll bring you expert answers unlike anywhere else. On tonight's show, we'll be discussing incels, aka involuntary celibates, with our very special guest, Dr. Oren Amitay. Dr. Amitay works with a diverse group of clients covering every theme imaginable, including issues related to sex, sexuality, gender, relationships, family, major life transitions, depression, and anxiety, to name a few. He's also an expert witness for the courts who's conducted nearly 500 parenting capacity assessments. I invited him tonight because in light of some recent tragic events, he was one of the media experts on the subject matter. Welcome, Dr. Amitay. We're so delighted to have you joining us tonight.
Thank you, Rebecca. Always a pleasure.
Thanks. Perhaps you could begin our discussion by defining what an incel is and briefly comment on the movement, if you may.
It depends who you ask. So, I mean, technically it's involuntary celibates. And if you ask some of the people in the organization, especially the self-appointed leaders, they will describe it differently from how others will. So other people have described them as a very misogynistic, desperate group of men who aren't able to find partners, usually women, whereas the incel members, they'll simply say that, you know, we're victims of our circumstances and we're bonding together to try to help each other, you know, support each other and help us do better in life so that we don't, let's say, run afoul of the law of people or whatever else. But they try to, you know, it's portrayed in different lights depending on who you're asking.
Who you're asking, because they're certainly not going to fess up to the misogynistic piece, and they're almost playing the victim to some extent, and they're certainly not going to see themselves the way the rest of the world will see them. So that's a great point. Why is there a rise in incels today?
You know, I have so many patients who are younger, and I say, I don't envy you in today's dating world because there are several factors at play. And I said this years ago when Tinder first came out with this swipe mentality.
Right.
It's leading people to believe that there's always someone better out there for them. And so they're always looking for someone who might be several degrees above their weight class, right?
Right.
And they think that people are disposable because if I don't like you, toss you aside, swipe next. And so there's more of that going on, and whether it's that, online dating, however you want to portray it, people are having a harder time finding and sustaining serious relationships is part of it. And the other part is that we've become a culture of victims. So these incels, instead of working on themselves, I know we'll talk about this, but instead of working on themselves, seeing how they can improve their lives and maybe reducing their expectations so that they're not aiming for a 10, maybe they're only able to get a 7 or a 4 or 2. That's okay. But instead of recognizing that, they think, I deserve the best.
Yes, there's that entitlement piece, I deserve the best. And it doesn't matter if they're 2 or 3 or 4, they feel that they deserve the 10. And I'm glad you mentioned the swipe right, because it's made people almost like a disposable commodity.
Yes.
You know, if I don't like you, I'll just go to the next person, and I'll go to the next person. Or they feel that there's all these people waiting around just to have sex with me. And if it doesn't happen, then you have the people who are furious. Why isn't it happening? And they go into the victim mentality. Now, among those who are only temporary hetero incels, I believe use the term, what kinds of experiences have they had with women that contribute to those negative feelings towards women? There's certainly the misogynistic piece, but what kinds of experiences have they had?
Well, I want to be careful because we don't want to blame, you know, women for their circumstances. But there are some, I mean, I've had quite a few patients, and this is only in the last couple of years where I've seen that. And again, I don't want to put the blame. If a woman is a victim of a horrible misogynist, I would never say it's her fault.
Right.
But I am seeing far more women being unsympathetic, being overly demanding, having unrealistic expectations of their partner. So there's a lot of pressure on them. And as we know, if you're having difficulty with any type of performance sexually, the last thing you want is pressure, fear, anxiety, fear of judgment. And unfortunately, a lot of these men are experiencing that. So that's a huge part where it's just there seems to be a lack of compassion in the sexual world, hyper-competitiveness, you know, because, and as we said earlier, with all these apps and all these online, you know, sites dedicated to this, people are just, they keep looking for people who are better than these incels.
It's sort of like, there's so many people out there, but they don't belong to you. It's like someone, going into the line of credit or credit card thinking that I have all this wealth. Well, you don't. You can try and borrow against it, and who knows what's going to happen. But you're right, and I'm glad that you mentioned the partner as well. Again, not implying in any way that all females are like that, but even men who don't necessarily identify as incels, who are trying to date, many of my clients, what they'll say is that the women are giving them these signals that they want them, and they're just kind of bringing them into it. They're teasing them, and they're giving them their information, whether it's social media or phone number or whatever. So the guy's thinking that you're really interested, and then they pull the plug without an explanation. They'll ghost them. They'll have no empathy. Like, they wouldn't want that done to them.
Right.
So are you finding that as well, that, you're talking about lack of compassion, so that unempathetic kind of leading someone on and then pulling the plug? Are you seeing that as well?
And I'm seeing it, I am, and I'm seeing it with both sexes.
Yes.
With straight or gay, doesn't matter.
Yeah.
And, it's funny because it seems that all of my patients don't do this. They're the ones who are victims of this, because they all say, how rude is it, as you said, to ghost somebody? No, you don't know anybody, anything, but a little bit of common courtesy, a bit of decency goes a long way.
Right.
And because people are becoming such online individuals, they're losing that sense of empathy because they're not spending enough time face to face with people. They're not suffering the in-person consequences of being a jerk. It's all being done from a distance.
In-person consequence. And I mean, we're losing a sense of emotions. If you're going through something and I want to give you a hug, a meaningful hug, that looks very different from me sending you an emoji because you've had a loss. I mean, it's nice, I'm thinking of you, but we've lost being in touch with our emotions. So certainly that must be a huge piece as well, because that's part of socialization, and it's sort of not happening. Now, we've been talking about technology. How do you think it's contributed to this movement?
Well, first of all, the most obvious is that it gives a voice to many different people. So in the old days, an incel would have been stuck in his basement or in his parents' basement alone, muttering, upset, and there's nothing he could really do with it. It would just be bouncing around in his head. Now he goes online, and there's lots of forums and websites that are dedicated to like-minded people. And we are social animals, so there's something really attractive to a bunch of like-minded people. And the problem is, when you get, as you know, like-minded people together, their viewpoint, especially if it starts off relatively extreme, becomes even more extreme because they're all fueling each other, and they're feeding into this dislike and hatred sometimes of women. So I think that's one of the biggest elements of it.
The gang mentality, because now you're ganging up
Right.
together. And I mean, online, so quickly a conversation can turn into something awfully hateful. And so you're taking something that's already pretty volatile
Right.
and messy, and then you're bringing all these people together and sort of throwing them in a room together, so to speak, emotionally speaking. You're throwing them in a room together, and the hatred, it just takes off from there, and the contagion, it just kind of messes things up. Wow, really enlightening stuff, Dr. Amitay. Coming up, more on incels, including therapy, so be sure to stick around. Welcome back to Sex with Rebecca, a show where we bring you expert advice on important matters to help your relationships be more intimate, exciting, and emotionally fulfilling. We've been discussing incels with our very special guest, Dr. Oren Amitay, who deals with them among myriad other conditions. Dr. Amitay, I have a lot of clients who, as I've mentioned, don't necessarily identify as incels, but who are beside themselves for some similar reasons, not same by any means, and they get to a point where they're self-harming instead of harming others, and some of them will end up going to prostitutes for aggressive sex because they're really upset, and some will go to the other extreme where they're depressed, they're withdrawn. Can you comment on that, and what do you think is going on there?
Well, with the self-harm, I mean, it's a type of punishment. It's a type of desperation. It's such like, if no one is valuing me, I must be valueless. So I am worthless, and worthless people or worthless things don't deserve proper treatment. So the opposite of that, as you're saying, is this type of self-harm, and the saddest thing is that they have such there's a disconnect between what they want in life and what they're being told they should have in life, right? Because they're
Yes.
seeing this on social media, Facebook, whatever, and what they really are experiencing, and they assume that they're the only person who is so miserable. They assume they're the only ones who can't get a second date when they go, meet somebody through Tinder. And there's all these other assumptions that they make, and they believe it's all only them. And that's very isolating when you feel that you're the only person. Or if they're an incel and they go to a group like this, then they see that it's so many people who have the same experience, but it's all because, in this case, it's because of women. So if they're isolated, if they're alone, they're more likely to self-harm because they don't have that outlet. If they're with a bunch of these incels, then they say, aha, there is, a target, and I'm not the only person who feels this way, so it must be valid. And then they're more likely to maybe be aggressive toward others.
The hatred grows.
Yeah.
I'm really glad you mentioned the piece about being isolated, because one of the things is that people that are isolated, but they're still kind of looking at social media, and social media exaggerates stuff like crazy. I know people who are literally crying on my couch, so to speak, and who are saying that their lives are so unfulfilling. They're horrible. They're unhappy. Their lives are horrible. They're unhappy. And yet, if you were to look at their Facebook profile, they're having a great time. They have, these pictures that show as if they're always having the most wonderful time. So somebody who doesn't know that is going to look at it and say the rest of the world is having a good time, because that's what we post. We don't post the ugliness, the sadness. And so it can make you feel that I'm the only one who can't get a date or a second date or get laid for that matter. And it just, the impression that's being created is so different from the reality. And we don't have those close connections to check in with others. Hey, what is reality? Because we're not having those conversations.
Right, so we're not having the conversations, and maybe the few times that we come close to having them, they are either superficial because people aren't bonding on the deep level, or the person doesn't feel like opening up to someone else, so they aren't sharing their misery with that person, and so that person, again, as you say, they feel I'm the only one. And this FOMO, this fear of missing out phenomenon, right?
Right.
It's just being exacerbated by social media.
Absolutely, because of the picture that's painted.
Right.
Now, some of the common themes that are coming up in my own practice are as follows. A lot of these guys, they only chase super hot women, the 10s. Some of them come from families that don't socialize them to have that know-how to meet and mate in healthy ways. Some are enmeshed with their moms, so it leaves them kind of with mixed feelings towards women. They don't want them controlling them. And some are actually raised in misogynistic families where women have no value and are there just to serve men. Is this sort of consistent with what you're seeing, and can you comment on the themes that you're seeing and some of the themes that I've mentioned?
Well, the first three that you're mentioning, for sure, I see a lot. I have seen also some men raised by misogynistic men as well, or by some really terrible mothers. So that's, of course, fosters that resentment as well. But this idea of unrealistic expectations, chasing the 10s, this inability to introspect, to look inward and say, what am I bringing to the table here? Right? What am I doing wrong? Instead of looking at what everyone else is doing wrong, this is what I spend most of my most of my therapy with these types of men in doing. Is it's showing them that what, A, have realistic expectations.
Realistic.
Right. B, there are some things that you can improve on. Right? Whether it's hygiene, whether it's the clothes that you wear, whether it's your personality, whether it's trying to to be funnier and so on. C, be a nicer person. Right? Because so many of these men believe, well, the only reason I'm not getting lucky is because all the assholes, I hope that's okay to say, the bad guys are getting all these women because women only like bad guys. So can't beat them, join them. And so they try to emulate them. And there's a wide variety of materials and resources that teach them how to be these bad guys, right? And
more materials that teach them how to be a bad guy than how to be a nice guy.
Right,
and then
because
there's
nice guys don't get laid.
Right, that's the impression. And that entitlement, I deserve this, and why is this not happening? And then it kind of creates a vicious cycle, because if you're putting arrogance out there, people are going to back off. And I'm not saying that people don't give the wrong cues, but certainly it'll do that. Any other themes that you want to comment on?
Well, the most important that I find is normalizing their experience. Going back to what we were saying about letting them know it's not only you. So that's why I open up every single session when someone comes in and having trouble with dating. I say, I don't envy you. because you're going through something that we've never had before, right? Evolution has shaped us to where we are today, and then in 10 years or slightly more, suddenly everything about socialization is changing. Our brains can't keep up. So it's the Wild West out there. And so many people are operating on their own assumptions about this is what you should do, this is what everyone thinks. So for example, if I've gone on 2 dates, now I should take down my profile, for example, whereas other people think, no, not until 20 dates or something
If
else.
ever at
if
all.
ever, right?
Yeah.
You always want to have that in the back pocket kind of thing.
Right.
So yeah, so it's just helping them understand that they're not the only people. Others are struggling, and
same
with the
things.
same things.
Yeah.
Those other people also succeed.
And the attachment piece and the sexual piece, you're talking about the old brain that's like thousands of years old, and even the cerebral brain hasn't caught on with what's going on in cyberspace. So there's an internal war going on. We suddenly have to act in a certain way, and our body is telling us something else, and there's just a lot of conflict there. Tying into that are their attitudes towards sex, women, and dating. Can we discuss that next, please?
Well, one of the things that has happened, and it's an unfortunate consequence, is the whole Me Too movement. So many men that I've been working with, they don't know how to conduct themselves. They're terrified that if they flirt, if they ask for a phone number or something else, they're going to be labeled as a horrible person. Or if they go on a date, and I've had many young men say this, and I tell them, your fears are not unfounded. If we go on a date, have a few drinks, which is totally normal in most cases, and then we have sex, what if she regrets it? Is she going to say that I raped her? And so I wouldn't want to denigrate the people who've had real experiences where they have been victimized, right?
Yes, because most of the people, the Me Too movement has definitely had the advantage of helping those people come forward. But I see your point on the flip side.
Yeah, and it's causing so much stress and anxiety for these young men. And I've been teaching human sexuality for about 17 years, and I've seen the change in the people, men and women, expectations. How do you progress your cause or advance your cause? If you're making out a little bit, what do you do next? How do you have a contract that you sign where you can send here, there, and And so again, as we said earlier about brains not catching up,
right?
People are really having a hard time negotiating what used to be. It was always difficult, it was always challenging, but there was something that we all kind of agreed upon. There was a script, or several scripts.
Yes,
that
an
we all
unwritten
understood.
script.
Yeah.
So you could kind of navigate through it.
Right.
But now we don't have that, so it leaves people quite fearful. And with all that stress and pressure, there's performance anxiety. I don't even know how guys get it up anymore. Well, hold on to that thought. We'll be right back with lots more still ahead. Treatment for incels and others who are struggling to find relationships when their hormones are prioritizing it above all else. So don't go anywhere. Welcome back to Sex with Rebecca, a show geared towards making your relationships the best they can be, both in and out of the bedroom. We've been discussing incels with Dr. Amitay, psychologist extraordinaire with extensive experience in treating myriad disorders. Now, speaking of treatment, Dr. Amitay, how do you treat individuals who struggle with this issue, incels, so to speak, from your perspective, not the way they see it?
Right. Because many of them may have some personality disorder, they might be narcissistic, for example. That's, of course, as one of the hardest issues to treat.
Absolutely.
So what I always do is I try to show them why it's worth their while to change what they're doing. I don't try to say, be nice for the sake of being nice, be nice to women for the sake of being nice to women. I say, this will help you achieve your goal. And
what's in
that's
it for you? And it speaks to the reptilian brain because there's sort of a concrete thing. So that's really good. And you mentioned, a lot of them are narcissists, and it's on the same spectrum as sociopathy. So some of the recent events, it's probably closer to that end.
Right, and this is my own classification. There are different types of narcissists, as you know, but we have the malignant narcissists closest to sociopathy, and then we have what I call the pathetic narcissists. And many of these incels are the pathetic type where they're just stuck in a land of fantasy because they know somewhere deep down in their brain, in the unconscious, they know that they are lacking in many areas, right? So they have to compensate for that by, glorifying themselves, by seeing themselves as something that they really aren't. And unfortunately, that contributes to the sense of, I can get a 10, and I deserve a 10.
And I deserve a 10.
Yeah. So,
DSM should definitely include that particular category, because I see a lot of that as well, and it's just heart-wrenching because people don't see that. I mean, certainly there's the covert narcissist, but this is not the martyr. This is the I deserve it,
Right.
and there's something wrong with you, not in me. Kind of trying to engage in more, better socialization and behaviors where this leads to this, and it's not going to be definitely the way I'm dictating it.
Right.
I guess it would also depend upon the underlying issues. So can you comment on some of those issues? You already started to talk about those.
Well, one that I have a lot of sympathy for is my patients who are on the autism spectrum, high-functioning autism. I think many incels could be classified as that.
Absolutely.
Because we know that they are socially awkward, they can't pick up on cues.
And sexually, too, there's a lot of stuff where they're not quite sure where they fit in, and they might try to belong to a particular group and take on, like a chameleon, what the group is saying they're supposed to be thinking and feeling.
Right, exactly, because that's what they're identifying with, and they need to, they don't, and the other people who don't have a strong sense of identity, then they're just being absorbed into these types of groups. Once again, as you said, they are being told this is the way to act, and a lot of them, unfortunately, just didn't have strong, healthy, positive male role models to show how to act. So I try to do that for them. I almost reparent them in the sense that I try to be that strong, healthy male role model and show them they know I'm not a wimp. I'm not overly gentle. I can be pretty crude. I can be blunt.
Direct.
Direct as well. We can joke around and everything. I can get down and dirty with them. Yet in the end, they get that sense of, you know what? I'm a nice guy.
Yeah,
I'm
so
a
you
good
can be
person.
strong and you can still be good. You don't have to
Exactly.
be an a-hole. You can really be a nice guy. And I think the transference must be really good too. So you become that surrogate parent that brings those things to them. And I think it's also like, especially for the person who's isolated, because initially, like when the goth movement came, it was, okay, so here's the bullies, here's the geeks, and here's the popular kids. And the kids who didn't belong anywhere, they had to group together, and they didn't even have any particular way of bonding other than we don't fit anywhere else. So what do we do? And how can we intimidate others so they don't bug us? Now, are there any signs that families should be on the lookout for to ensure that they stay in touch with the kids' struggles and ultimately get them the help they need? Because a lot of these people, they have things that they show that they're not quite right.
Right. We have to be careful because we don't want to over-pathologize. But the number one thing, if we see suddenly somebody is showing a dramatic change in their demeanor, so maybe they're more withdrawn, and as we were saying earlier, this isolation is fatal, especially since they're not just going to be isolated. Now they're going to be isolated and in contact with a bunch of other isolated people, all spewing hate and everything.
And
So
they're not properly socialized either. So
that's huge.
So that's a big one. And I'm glad you said not overly pathologized, because I am working with clients who are really nice guys. I mean, they are wonderful guys. And I don't see why they are in that undateable category, but it could be their own insecurities. It could be that they just don't know how to be, so they don't have the confidence. So not all of them are somehow flawed. Some of them just, it comes down to the socialization piece. Now, what's your advice for incels themselves?
Well, I would say for some of
Go
them,
see Dr. Oren Amitay.
yeah, well, and for others, grow up. I don't want to be so blunt, but you have to be realistic. We've used that word quite a few times today, and no one owes you anything, and that's something that I teach my patients, all patients, not in a negative way, but more like just saying, if no one owes you anything, if you don't have these unrealistic expectations, that forces you to work on the one thing that you know you do have control over, which is yourself. So improve on yourself so that you can get those things that you want, because nobody's going to come and just hand it to you. And you might be resentful of people who seem to have got it all, and there are some people who didn't have to work hard for it, but don't expect it. So, I mean, to the incels, that's what I would say. Work on yourself, focus on yourself, don't be so bitter about the rest of the world. And the fact is, many people have many different reasons to be upset at the world, right? And we can't let that allow us to either, dictate who we are, how we conduct ourselves, how we feel.
And you can certainly, if you put the focus inwards, you can own it. You can own your journey, and you can work on yourself. Thank you so much, Dr. Amitay. Some really remarkable insights you gave us today. We really, really appreciate you coming tonight.
Well, thank you. It's always my pleasure. It's an honor.
Still ahead, breaking some common sexual myths. So don't go anywhere. Welcome back to Sex with Rebecca. Now, before we close, as promised, some stats that'll break some sexual myths that might be messing with your head. Number one, the average erect penis measures in about 13 centimeters. When women were asked if size mattered, only 1% said that it did. And when they were asked what's more important, length or girth, 21% voted for length and 32% voted for girth. Number two, 85% of men and 45% of women masturbate even when they're in steady relationships. 3. The average duration of sex from penetration to ejaculation is 6 to 10 minutes for most men, 1.8 minutes for those who struggle with premature ejaculation, and 3 minutes or less for those who struggle with erectile dysfunction. 4. 7% of partnered people have sex 4 or more times a week, 34% have it 2 to 3 times a week, 45% have it a few times a month, 13% have it a few times a year, and 1% have it less than once a year. Number 5, 85% of non-orgasmic women say that they're still satisfied with their sex lives because they enjoy the connection and the touching. I hope this alleviates worry for many of you, because in my private practice, most people who fit national averages are scared that they're somehow deficient. Thank you, viewers, for joining us. Be sure to tune in again next week. And don't forget to email us your questions and subscribe to our YouTube channel to catch up on missed episodes, to watch your favorite shows again, and to access some hot stuff that can't be aired on TV. I'm Rebecca Rosenblatt, your host, wishing you happy, healthy, and passionate relationships. Until next time.